Hi, this is author Avalon Brand, RN, BSN. I just want to talk about nursing for a while. I recently, maybe a year, 2 years ago, retired from nursing, but I continue to stay in touch with my friends. I hear so much about what's going on in nursing, and I think it's ridiculous, especially the phrase they use, nurses eat their young. I guess it's still going on. I started nursing back in 1983, and I went through my own bullying. I went through my own struggles, my own trials and tribulation. I decided to start writing about mine. So the first thing I wrote was a memoir. Okay? It was The Devil All Along. And I talked about my struggles, my challenges in nursing all the way up to 2010. That's where I stopped that book. I decided, okay, I'm going to revise the book and maybe write the rest of the years up to the time I retired. Instead of doing that, I decided that I was going to go out, reach out to other nurses, see what type of challenges they went through. So then I end up coming up with this book called Nursing is Our Passion, We Can't Quit. And in this book, I was able to get 10 nurses to write their stories about their struggles, why what they went through in nursing did not make them quit. Because there is just so much shortage, patient ratio, and just little nitpicking things that go on in nursing that can cause nurses to walk away from nursing. I know I worked at the bedside for 18 years before I went to outpatient dialysis. Then I stayed there for 20 years. I was a charge nurse. I ran the whole facility, and it's a lot of work. But then after 20 years of being there, I went into infection control. So no matter where you go, I went back into the hospital. No matter where you go, you're going to run into challenges in nursing. You may run into shortage. Things are going to go on. But if you're determined that this is your passion and this is where you want to be, you won't let nothing make you quit nursing. You have to be strong. I even wrote a book and allowed the men to express how they felt working as male nurses, because they also go through challenges that we don't even realize. They have their own challenges that they go through as nurses. So I wanted everybody, male and female, to write about their challenges, what makes them not quit the profession, because I personally loved nursing. When I was there, I loved what I do. I went through some bullying like anybody else, but they could only bully me for long because I stood up for my rights. I know my not to pat myself on the back, but I know that I was an excellent nurse. I did my job. I was organized. I had time management down, and I did what I needed to do as a nurse. So no matter what they did, because some of the bullying came from managers, no matter what they did, I still persevered and resilient and did my work, because no matter what they do, even when things were nitpicking, my work spoke for me. So after doing all that, I decided, okay, why don't I just start? I started hearing about all this bullying in nursing. So I wanted nurses to start speaking up, because people don't realize what goes on sometime behind closed doors. So I know how nurses are resilient, and I know how sometimes they're reluctant to tell what's going on, but they should really speak up, because this nurse bullying is a thing that I don't understand. We all start from the bottom. Why do you need to bully a nurse? If you're too tired, then you let your manager know that, okay, I don't think I'm a good preceptor. I've also been a preceptor. I have trained many nurses. So I got some nurses together. It was only 5 nurses that were willing to speak up, and I wrote a book about bullying, how to rise above bullying. And these nurses still, I care, rising above bullying. They told about their bullying experience. They also talked about how they rose about it, and they didn't leave the job. And this is something that's going on, and it's so unnecessary. There's no reason for me to bully another nurse or a nurse to bully me. If you don't want to be bothered, if you're too tired, then don't train me. Allow someone who has patience, who's willing to let me learn, who's not rushing me, and let me do my job. So after all that, I said, okay, why don't I start putting out some of my experience to encourage nurses, to let nurses know what I went through, what you have to go through. So I started up with these guides that I'm doing a series. The first one I came up with was a guide for nurses to flourish in their profession. So this book, it kind of tells you all the steps you need to do. If you are thinking about getting into nursing, these are the things that you need to think about, read about, and see. Then I decided to write another one, a guide for nurses learning to cope with patient loss. What you need to do, how to do with that. Because when you're a new nurse, I started a floor with 5 new nurses on the day shift. I was the only experienced nurse. Their first code was actually me. I passed out while we were doing a spinal tap with the doctor. When I stood up, I just blacked out. And that was their first code. They were one of the nurses. They said she just ran around saying, "This Avalon, this Avalon." And everybody was so frantic because they were new. This was their first code, and their first code was their coworkers. So how would you cope with something like that? How would you cope with your first patient that actually died? I didn't die, but they got the crash cart, but I didn't die. They didn't have to use the crash cart, thank God. I woke up in time. But what if you are a new nurse and so this book, I wrote a guide. I just finished another guide last month, a guide for nurses to learn to be charge nurses. What I am doing is taking my experience and putting it into guides, hopefully that the next generation of nurses or anyone that want to be a nurse will pick up these guides, read them, and get an idea of what they're going to get into if they decide they want these positions. So I have this is going to be a series of 6 guides because I also need to do a clinical manager. I've been a manager. I know how to treat the staff. I know how to show them appreciation. So maybe some of my experiences could help someone that wants to be a clinical manager. Same thing with the charge nurse book. So my thing is, and I've been a kidney transplant designee and a dialysis nurse, and I just like to put my experiences out there. But I'm hoping that in the future, nurses will start treating each other on a professional level because we want to keep that title of a profession. So we need to be professionals within our own selves. We need to encourage our nurses, encourage the young ones coming in, encouraging any new nurse so that they'll stay and love the profession. And the profession will become as passion as it became my passion. This is my hope. We need to encourage each other, support each other, be there for each other as nurses. Stop all this nurse bullying. It's not even necessary. Anything that I have, whenever a new nurse came in, maybe they had new knowledge for me, something that I didn't learn years ago, and they're bringing something new to the table. Don't feel like they're superior. Don't feel inferior to them because they're bringing something new to the table. There's always someone that is smarter than you. It's best for you. Step back, take the time, and learn something new. That nursing is always changing. Every year, nursing changing. So it doesn't hurt to have somebody come in with some new perspective, showing you something new. Take advantage of it. This is author Avalon S. Brown, and I'm hoping that you take a look at these books or just remember what I just talked about as far as supporting each other. You can also go to my website, author-avalonsbrown.com, and purchase these books or go to Amazon. But my message is really about us as nurses standing together, supporting each other, caring about each other, taking our young and bringing them in and embracing them and teaching them all the knowledge that we know. Don't be afraid to give the next person your knowledge.